Hey, welcome back to another episode in the Simple Nutrition Insights podcast. I am your host, Leonila Campos, registered dietitian. And in today's episode, I am so excited to have a special guest, Dr. Raghid. And I am going to give you a little bit of introduction about her. She is originally from Long Island, New York. She was born in the field of medicine. For as long as she can remember, being a physician has been a lifelong pursuit. After high school in Hewlett, New York, without a doubt, she enrolled in Dow University of Healthy Sciences in Karachi, Pakistan. And it was here that she began to understand the disparities of women's health from a rural to an urban setting. With a passion of comprehensive care, Dr. Raggett completed her residency at Western Michigan University in Kalamazoo, Michigan, where she served as a chief resident. The multidisciplinary training allowed for her to pursue further patient-centered specialty care. Dr. Ragged's passion for female well-being led her to fellowship in advanced women's health and high-risk surgical obstetrics, the University of Tennessee in Memphis. Here she honed on her skills as an advocate for comprehensive reproductive health and neonatal care. Dr. Ragged then moved to the Central Valley where she resides with her husband, and she also has now her own private practice, Wise Care. And so I'm really excited to have her with me today. We're going to talk all about obesity, right, and the GLP-1 medications. It is important that we get the information from reputable resources from your doctor and know, there's a lot of noise about specifically the GLP-1 medications for weight loss. Sometimes the information is not accurate. And so you want to make sure that you get your information from the professionals that have the background and they know what they're talking about. So welcome, Dr. Raggett, to the episode. Thank you
Thank
so much.
you. Yeah, thank you so much. I'm so excited to be here and talk about something that I'm so passionate about. And I feel like, just like what you said, it's so important to go to a reputable source because there's so many fad diets, so much misinformation out there that any person would get really confused with all that data and information.
Yes, absolutely. So thank you so much for joining me. So let's start first by explaining the underlying causes of obesity and why it's such a complex condition to treat.
Sure, absolutely. Yes. It's interesting that the American Medical Association actually didn't even recognize obesity as a chronic illness up until pretty much the last 10 years. And it's mind blowing because obesity it is a chronic condition. And we know that the pathogenesis of it is multifactorial. We also know that having obesity also increases your risk of other medical conditions like diabetes, hypertension, cancer, and other conditions. So why obesity is such a difficult condition to treat and underlying things that kind of increase your risk is genetics. It could be a higher occurrence in families. You can have a genetic predisposition to obesity. I have a lot of patients that tell me that their parents are overweight, their siblings are overweight, they're overweight. This can be related to genetics. It can also be related to environmental lifestyle, right? The food that we eat in our cultures, or even the day-to-day food that we eat from the grocery stores that are processed. Our lifestyle, if we didn't grow up, with our families emphasizing physical activity and exercise. If kids are more put in front of the TV and less stress of going outside, and especially with social media and the television and things like that, that also increases a risk of obesity. There's other medical conditions that increase your risk of obesity. So let's say if you have hormonal issues or if you have sleep apnea, PCOS, which is a very, very common thing that I find in women, metabolic syndrome, where you just have multiple other conditions related to weight. And then not to mention stress, right? That's a huge trigger for weight gain as well. So it becomes difficult to treat because there are so many issues and the interplay of them, like what we just discussed. And so in order to treat obesity, we do have to address all of those issues. And so whenever I have my patients, we're not just talking about weight loss. We're talking about, let's talk about what your home life is. How is your stress? How is your sleep? What are the conditions at your work? How do you eat your meals in front of the TV? What kind of forms of physical activity do you have? So, it becomes difficult to treat because a lot of clinicians are not addressing all of these aspects that contribute to obesity. And then, patients are also not understanding that you have to address all of these things because they do contribute to being overweight. It's not just, and what I try to explain to my patients, so it's not just about you eating less and moving more, because otherwise I think we would all be thin, right? But we know that's just not the case.
Yeah, oh my gosh, I love everything that you just said because it's absolutely true, right? Obesity is very complex because of all those factors, right? And it's not like just
Right.
like you said, oh, let's just focus on eating less, moving more. It's not the case, right? There's so many things that affect the way that we eat, right? Our environment, either our environment at home or at work, right?
Yep.
Stress and sleep, which is oftentimes is not something that, like you mentioned, is talked about, right? But it
Hmm.
plays a huge role in like everything else, and so not not addressing everything, right? Um, it's definitely a challenge, and so yeah, we have to focus on every single one of those things, which can take time, and but it's something that it needs to be done.
Yes, absolutely. Absolutely.
So let's focus more so as well on the role of weight loss medications, right? I think it just
Hmm.
blew, within the last year or so.
Hmm.
How do weight loss medications work, and what role do they play in the overall treatment of obesity?
Sure. So, we know that the gut and the brain are connected. And to simply put it, when you're upset, it does affect, like mentally upset, something sad happened to you, you went through something traumatic, it does affect your appetite, right? You are either a person who uses food as a crutch and a coping mechanism, or you're someone who loses their appetite. But why does that happen? Why does our mental health affect our brain? And it's because we know that there's connections, neurological connections between the gut and the brain. And so one of the medications, the GLP-1s, which like you said, have literally blown up in the last couple of years, GLP-1 is a natural hormone that's produced in our gut, okay? It affects and it regulates our appetite. And so the GLP-1 medications, they kind of act as an agonist. They increase that action of the natural hormone, okay? And so naturally that hormone's job is to slow gastric emptying. And so when you're taking an additional aspect of that hormone that kind of works on that receptor in our stomach, it increases gastric emptying, which leads to the feelings of fullness and decreased appetite. Decreased appetite is also a stimulus where where the gut and the brain are talking. If your stomach is not feeling hungry, your brain is thinking also, I'm not hungry, I don't really need to eat right now. So all of that leads to a decreased appetite. It also helps lower blood sugar levels, which also leads to weight loss. And one of the biggest things that I also see with my patients, it's anti-inflammatory properties. We're not exactly clear on how that really works, but it definitely has anti-inflammatory properties. I have a lot of patients on GLP-1 medications that have inflammatory conditions like, IBS, rheumatoid arthritis, lupus, arthritis. And so they often tell me that for some reason their joints feel better, and it could be a combination of losing weight. But I do think that the medications also have some type of anti-inflammatory effect that, affects them long term. So, I know a lot of patients are kind of a little bit nervous with taking the medications, but the GLP-1 medications as a class, they've been out for about 20 to 25 years already. It's just recently we've been using them for weight loss, but we were in the past using them for type 2 diabetics. So, yeah.
Yeah, awesome. Thank you for explaining that. Oftentimes it's not knowing that, right? Like, hey, it's not something new. Because
Right.
you just learn about it, it's just news. As you mentioned, they've been out for years and years. And so, with that specifically, right, in terms of the efficacy and safety, what are the most effective weight loss medications currently available? And what should patients be aware of in terms of like potential side effects?
Right. So, yeah, like I mentioned, I think the GLP-1s are the most effective medications right now. They are increasingly safe, where I think, because the amount of patients that are on it, the FDA, the USDA, everyone is performing a lot of studies in terms of safety and long-term use. Certainly, we had type 2 diabetics on them for many, many, many years. I think one of the common things that patients hear is, the risk of thyroid cancer. So in some studies, which were only done in rodents and rats and stuff, it showed an increased risk of a specific type of cancer, which was medullary thyroid cancer. Okay. So that cancer in itself is extremely rare. We have looked at the data in humans and we have not been able to see those same, risks of cancer. Obviously we have to, that is a, black box warning. We definitely want to warn patients of that risk. We are very cautious in terms of prescribing those medications to anyone that has had a history, personal or family history of medullary thyroid cancer. I honestly have maybe come across it one time a patient had a mother with a history of medullary thyroid cancer, and we weren't able to use the GLP-1s, but that's definitely a screening question that we ask for safety reasons. More common side effects are things like nausea, diarrhea, and constipation. Very rarely it can increase your risk of getting gallbladder stones and pancreatitis. But of course, those are all things that we kind of talk about, with our patients to better understand, hey, are you a good candidate for it or not? Like with any medication, not everyone is a good candidate, but overall the medications are super safe and their side effect profiles are pretty low, with, the nausea, diarrhea, and constipation being the most common.
Thank you. Yeah, that's really helpful, right? To understand that the safety of these medications, right? The side effects, and the warning. And like you said, right? Not all medications are going to be for every person. And so having that screening, right? Making sure that each person is the right candidate for it, is helpful.
Mhm.
Um, in terms of personalization of treatment, right? How do you determine which weight loss medication is best suited for a particular patient? Are there specific factors you consider when it comes to that decision?
Yeah, of course, definitely. So most of my initial appointments are about 45 minutes to 60 minutes long. It's really important for me to understand kind of the background of the weight gain. So it's about understanding their history, is the weight gain related to trauma, depression, some type of mental health thing that happened, pregnancy, postpartum, understanding the interplay of correlated diseases, right? If we can't fix your sleep and your stress, the weight loss is going to be difficult to treat. So I tailor it to also, like, what worked, what didn't work in the past. So addressing everything in a comprehensive approach is, very, very important. I ideally love to start my patients off with a GLP-1 medication. And like I said, the class of medications are pretty much the same, but sometimes one injection can work better for the one person than the other. But yes, usually I love to use GLP-1 medications because I do think that they are the most effective. However, sometimes we do have to tailor it to patients specifically based on insurance and costs and things like that.
Okay. I think we jumped right into the GLP-1 medications, but for the listeners that maybe have no idea what they are,
Yeah.
what are some examples of GLP-1 meds?
Yeah, so GLP-1 medications are like, the brand names are Wegovy, Ozempic, Zepbound, Manjaro. There certainly are other medications that we can use for weight loss which I do daily. And those are phentermine, a Contrave, which is bupropion and naltrexone, and then metformin, topiramate. So there's certainly other options and stuff. Absolutely.
Thank you so much for that. I also love that you mentioned that you spend a really good amount of time with your patients, right? 45 to 60 minutes, which sometimes that's unheard of.
Yeah.
Because it's usually like when you think about seeing your provider, right? It's okay, 15, 20 minutes. But it's so true, right? You really have to understand the root causes, right, of obesity per se, or weight loss, or whatever the goals of the patients are, in order to really assist them, right, and giving them that holistic approach. So that's amazing that you're able to do that.
Yeah. Thank you.
Uh, yeah, awesome. So when we think about long-term use of these medications, right, can weight loss medications be used long-term? And if so, what are the implications for maintaining weight loss?
Yeah, so, absolutely. Obesity is a chronic disease. And like I said before, we should be treating it as such. When a patient has hypertension, we don't just start the medications and then their blood pressure gets better on the medications and say, okay, you're cured now, right? We try to put them on the lowest effective dose. And that's really, my personal approach as well. There's sometimes patients, they don't want to take injections for the rest of their life, or they don't want to take additional pills, and that's totally understandable. I really try to work with my patients and understanding, what is the best thing that's going to work for them. Certainly, I've been able to get patients off the injections and they've been able to maintain, but there are some patients who actually like taking it and they want to continue it. So again, it's really individualized, but yes, absolutely, the medications can be taken for long term.
Awesome. So we know that combination with lifestyle changes, right? How important it is for patients to combine weight loss medications with lifestyle changes such as nutrition, exercise, as you mentioned, sleep, and stress management.
Yeah, great question. It's so, so important for us to address it with them, and then for them to actually work on these things. So that is something that I talk about with my patients on every single visit. We try to work together to increase their, physical activity. So I have a lot of patients that come in that say, we really don't do anything outside of going to work, maybe walking around at work and then coming back home. And while that is great, we have to dedicate a certain amount of time, focus time, that this is going to be my workout time. Not only is it important for your mental health to kind of just separate everything else and dedicate and focus that time to yourself because you deserve it, but it's so important to develop good habits, right? And so absolutely, it's so important for patients to work on their diet and their exercise, because the medications are only, they're not a magic pill. They're not going to work to do all the work and substitute what your diet and your exercise would be additional supplements to losing weight.
Perfect. Yeah, I love that you definitely are mentioning that, right? Because it has to be, again, a comprehensive approach. And so, yes, we're using the medications, right? But we still have to make these meals balanced, right? We still have to get the nutrients because we want to be able to fuel our bodies properly. Right? We want to be able to move our bodies for long term health, right?
Yep.
And all that. So yeah, awesome. I'm glad that you also mentioned that to your patients. So I think it's important to talk about the stigma, right, when it comes to like taking some of these medications. And so, how do you address the stigma around using, these weight loss medications, both within the medical community and with your patients?
Yeah, so there is a huge stigma about using medications for weight loss in general. I think some clinicians, unfortunately, who are not very well versed in obesity medicine, see that it's a quick fix. Definitely, certainly, there are some patients that don't understand that this is in conjunction with lifestyle changes, right? So having that conversation and making that conversation normal, that's something that I do on the very first visit, that, hey, the injections are only going to work as good as you make lifestyle changes. That is really when you're going to see the most amount of the benefits. Okay. And then, having that conversation with other physician colleagues, like, educating them on weight loss medicine. So I do have a lot of colleagues in the community, and, whereas maybe they don't have enough experience or feel comfortable with managing weight loss medications because of the side effects or the dose titrations, having that open door in terms of, hey, you can call me anytime or send your patients to me. And I'd be happy to kind of help with that weight loss process, has been really great. And then I find that, most patients want to talk about their weight. They just want it to be in a very respectful and a kind way and not accusatory. They don't want it. It's really about having someone to talk to in a nice and understandable way, and not being condescending and demeaning. So I find that as long as you approach it in a nice way, I've never had a patient give me pushback about, well, I don't want to talk about my weight. I find that everyone wants to talk about their weight. It's just really how you approach it.
Yeah, that is extremely important, right? And that you do that work with them, because it's so true, right? Oftentimes, and I hear this from my patients too, right? Like, I feel so nervous when I go and see my provider, or
Hmm.
when they're going to take my weight, because either there hasn't been that connection where they feel comfortable talking to them about it, or
Hmm.
because
Yep.
it's always like, okay, you haven't lost weight, or you keep gaining weight, right? It's
Right.
not more so, okay, let's figure out why this is happening, right? Let's talk about these things. And so, yeah, of course, they're going to feel like, oh my gosh, I don't even want to go to the doctor anymore, because I feel like I just, it's so triggering, right? So
Yes.
it
Yes.
is
Definitely.
wonderful that you talk
That's
to
the
your patients.
perfect word. It can be so triggering for so many of my patients. Absolutely.
Right. Yeah, especially if they've been, struggling with that all their life.
Hmm.
And it's something that they're like, I've tried everything. And, I'm thinking, I'm considering this weight loss medication, but there's so much information out there, stigma about it. Yeah, I don't want it to be seen as I'm lazy. And sometimes I see that too in like
Hmm.
Facebook mommy groups. They moms ask about these questions, right? Like, I don't want judgment. It's not that I'm being lazy, right? It's just that I struggle with these for so long. And as we talked about, obesity is not just like, oh, you just eat less and move more. There's so many other underlying reasons, right? And so um, I think, the more that we learn about it and just removing that stigma, right? Uh, is probably going to get a little easier for people that are wanting to consider these medications too.
Yeah,
Uh,
absolutely. I totally agree with you.
yeah, and I love also too that you have an open door, right, for other providers, other colleagues that maybe don't feel comfortable, right, with these weight loss medications, that they can reach out to you. And I think that is a great approach because if a provider, right, is not so comfortable, they can always either refer the patients to you or like, ask you, because as they're helping the patients further as well. So that's very nice that you do that too.
Yes, thank you. Absolutely.
Yeah, so let's talk about maybe some of these challenges and misconceptions, right? Like, what are some of the common misconceptions about weight loss medications that you often encounter in your practice or that you hear often?
Yeah, so probably that it's a quick fix or that they need to be on it for the rest of their lives. So I do encounter some patients who just want to take it for a short period of time and want to lose the weight that they need to. And for, the biggest thing first is understanding not everyone is a candidate for the medications. You have to be over a certain BMI, and you also have to have some comorbid conditions if you're not over a certain BMI to qualify for the medications. So that's something that I discussed early on, that it's not you have your brother's wedding coming up and you need to lose like 5 or 10 pounds to fit into your dress. It's really not about that. Thankfully, most of the patients that do come to my practice do understand, have really been struggling with their weight, okay, and they are honestly ready to make change. That's great to see. It's not a lot of me having to convince them about the process. I think they've done a lot of the research, and that's how they've ended up coming to me, is because they're either have tried with their PCP or have tried with themselves and they have failed. So majority of my patients have been fighting with their weight for a long time. And so, I think one of the common misconceptions is, that, nothing is going to work and that they're going to end up needing bariatric surgery. And while there are indications for bariatric surgery, we as a medical society are moving away from bariatric surgery because we do understand and see, and I'm sure you've encountered patients like this too, where they've had the gastric sleeve and they've had the gastric bypass and they regain the weight back, right? And so it's so essential in understanding how obesity works, in terms of understanding why is that happening, right? If we're cutting out portions of their stomach and making it smaller, why haven't we fixed the weight problem, and so we are understanding bariatric surgery is not the end all for that. And so just going back to lifestyle changes, understanding why are they gaining weight in the first place, like what is going on at home, what is going on at work, what are the mental stressors that are involved in all of that.
Yeah, absolutely. And I think again, it goes back to really investigating, right, that root cause and addressing it, versus like, okay, let's just do that particular thing, right, and see what happens. Because then we know what's going to happen essentially, in a couple years or a few months or whatever. And so, yeah, that's a good point there. What,
Yes.
in terms of future obesity treatment, right? What do you see that future of obesity treatment heading to, particularly with regard to the medication and integrated care approaches? Like, how do you see that change in a few
Yeah.
years?
So, it's been really great in the past few years, in terms of, some of the insurances finally covering the medications. It's still been a struggle though, getting, medications for patients. They want you to be, really overweight or really sick to get coverage. So that's a constant battle that I'm finding. So I really hope that we're heading in that direction, as well as insurance being more open to cover weight loss visits. That's kind of another huge issue, is that they don't cover weight loss visits. So hopefully insurance is going to kind of understand that, weight loss is kind of related to every other condition a person can have. I hope that the future is going to involve understanding the need for a multidisciplinary team. I've been practicing obesity medicine for a while now, and it's always been me just talking about their nutrition and the fitness and everything, and I love doing that. But some patients do need more help, and we do need dietitians like yourself on our team. Understanding that's a multidisciplinary approach, it would be amazing if they would cover gym memberships, as an incentive, or offer patients discounts or reimbursements if they lose 10 or 15% of their body weight and maintain it over the course of the year. I think, or gift cards or something. I mean, I think that the potential is endless. So really hoping that is going to happen. I think also there are new medications that are going to come out. Hopefully, Zepbound just came out this year, and a lot of insurance picked it up for weight loss. So that's been great, but that is an injection. I do hear that some oral medications, similar like GLP-1s, are going to be coming out. So that'll be a little bit more easier to get coverage and hopefully for patients to take. And then the biggest thing also that happened this year, in January 2024, was Medicare started covering the weight loss medications, which is amazing because this was a huge population that needed coverage. So they do have some criteria for the medication coverage, but I mean, usually when Medicare starts something, then other insurances follow. So I think that this was a huge thing to happen in the weight loss sector. So really excited to see what's going to come next year.
Awesome. Yeah, that is wonderful. I didn't know that Medicare is doing that now. So it is absolutely true, right? Oftentimes insurances follow what Medicare is doing. And so just that, that change there can bring a lot of positive things. I love, obviously, that you mentioned that multidisciplinary team, right? With having dietitians on board, right? And just working with the patient holistically, right? Encourage
Absolutely.
them to exercise, right? But either helping them with that specific, gym or trainer or whatever the case may be, right? Because it does help. As we mentioned, the root causes is not only eat less, move more. It goes beyond that, right? Stress management and sleep, which your husband is an expert in that area, and so I
Yes.
think it's so amazing that we do see the patient as a whole, right? Not only like parts, and we can continue to see those changes in just obesity treatment, right? Yeah, I'm excited to see that as well, and just the changes, and obviously for better health for patients in general, because we know, as you mentioned, right, even losing that 5, 7, 10% of their body weight can make a huge difference in their health. So that's exciting to see for sure.
Yes.
Yeah, Dr. Raghid, I know you're short on time. Thank you so much for your time, but I want to make sure that the listeners know where to find you. If there's a potential patient, right? Do you see only patients in the Central Valley in California?
Right. Yeah, so I'm happy to see patients via telemedicine as well. But yes, I am located in Madeira, California. You can put my office name and address and phone number there. But I am accepting new patients, and yeah, this is something that I'm so passionate about because I think it affects all facets of your life. When you feel good physically, you feel better mentally. You are able to put more positive energy into the world, and that is my entire goal.
Absolutely. I think that's a mic drop there. With nothing else to say. Yeah, definitely. I'll add all your information in the show notes. So if you're driving or if you're busy, but you can always go back to the show notes and reach out to Dr. Ragged, and just sometimes just talking to you, Dr. Ragged, is a great start, and then you can start moving the needle after that. So any final thoughts, anything else that you want to say, or anything else that you want to add?
No, but thank you so much for having me. Like I said, I love talking about this stuff, so it's been a great experience. But thank you so much.
Yeah, absolutely. Thank you. Well, thank you so much, everyone. Have a wonderful rest of your day. Stay safe and stay strong. Talk to you in another episode. Bye bye for now.